So, well, nurses like myself, every day we kind of breathe in these toxic fumes of the current healthcare disaster that they call a system, but we know it's not a system, right? I don't know, they call it a healthcare system. It's not healthy, it's not about care, and it's not a system. It's kind of a funny name for it. But tonight you'll hear from 5 others who are not nurses, because as you know, nurses define the world as nurses and non-nurses. We know that, right? Everybody's aware of that? So I won't even tell you what New Yorkers call everyone. And I'm from the Bronx, so I won't even tell you what the Bronx calls everyone else in New York. But I do want to mention a very important point, that the Bronx is the only part of New York City that is connected to the mainland of the United States. I think. So I really wanted to be a stand-up comic. I don't know how I ended up in the emergency room. So our first speaker is going to be Christy Offenbacher. Did I say it right? Uh-huh. Okay, so they're going to correct me because this is a very aggressive group here. She's a clinical social worker and a therapist in Brooklyn, New York. Not part of the mainland, but it is still part of the United States. She serves on the political education committee in her local Democratic Socialists of America. Let's hear it for the DSA. And also as a regional coordinator with the National Medicare for All campaign. Let's give it up for Christy. Oh, I have to remind you, I was told that at 9:30, somebody in this room is going to turn into a pumpkin if we're not done. So we have a very strict 5-minute thing for speakers. So I hate to do that to you. But.
Luis grew up supporting his single immigrant mother, following the murder of his father near his home in Bushwick, Brooklyn, on earnings from a drug run he'd taken up at 8 years old. When I met him, he'd spent the last 30 years of his life in and out of prison, bearing the cost of an economy that had for so long already abandoned its poor. The paperwork he brought in from the hospital indicated he was homeless and schizophrenic. In our initial meeting, he told me how often he is visited by the voice of his childhood best friend, whose rape and murder he was forced to witness as retaliation for a drug deal that went wrong. He woke many times each night at noises that resembled the sound of someone breaking in, to steal his few possessions or to harm him or a loved one. In the daytime, he feared flashbacks that brought him involuntary episodes of blinding rage, violent, directionless anger. These kept him from the art museums he loved, from the science and history exhibits that reminded him of his mother, of walks with her in Central Park, ice cream in hand. By the time he reached my office, Luis had been through 5 interrupted psychotherapies with 5 different psychotherapists, and upwards of 25 episodes of treatment on different medications to manage his schizophrenia, and, by those who even registered it, his PTSD. His medical and mental health care, both in and out of prison, had been intermittent at best, neglectful at worst. When, after 6 months, on a waiting list, he finally gained admittance to the clinic where I work, Luis was desperate to speak with a psychiatrist as soon as possible. He knew what meds he needed to calm the voices, he said, if only he could find someone to fill the prescription that had lapsed 6 months before. My name is Christy Offenbacher, and I'm a social worker and therapist at a public mental health clinic in New York City, where I also serve as the Northeast Regional Coordinator for the Democratic Socialists of America's Medicare for All campaign. Although in my professional capacity, I'm supposed to have officially sworn off having favorites, I will admit to you here today that Luis was one of mine. While his specific character, his sense for life, and his manner of communication are utterly unique, the major contours of his story are too often shared by others I see. It was in my work with him, and there's others, that I learned how Medicaid, while it offers free at the point of service care to so many Americans to whom it would otherwise be unavailable, as a means-tested system with severe limits to who it will cover, it's a mess. Community mental health clinics of the sort I know, of the sort I hear about from colleagues across the country, are a nightmare and a failure. And the people they fail, people like Luis, do not just disappear. They can't resort to other social resources like family, friends, and communities when those two have been burned by economic, legal, and environmental devastation. Since the 2015 announcement that Cook County Jail had become the largest provider of mental health care in the country, we know that many of these people are made to spend their lives being shuffled through the American prison system instead. And so, mental health care is a particularly acute example of the absurdities of our for-profit healthcare system. On the one hand, for those who can afford them, medications abound for an increasingly diverse array of diseases which are themselves often manufactured thanks to the deep ties between the American Psychiatric Association and Big Pharma. Pharmaceutical companies target chronic diseases like mental illness, because the people they afflict are dependable, that is to say, dependent consumers. It's sick. On the other hand, and for those without the means, those like Luis, who are often most in need of help, our mental health system is inhumanly and grotesquely cruel. When healthcare is run for profit, we get a host of cost-saving measures and ideologies of patient responsibility that do nothing to promote thoughtful reflection by patients or providers about what would really constitute those ideals of health and well-being that we supposedly cherish. When healthcare is run for profit through a means-tested system, we keep our providers' hands tied up in administrative and bureaucratic processes. Therapists are made to rush through complex and sensitive cases like Luis's in order to complete the piles of paperwork needed to justify his treatment in overcrowded and understaffed facilities. So, as a healthcare provider, Medicare for All represents a chance to create more functional and adequately staffed clinics. It means the redirection of time and labor currently wasted on administrative obstacles of a means-tested program toward direct service provision for those who need my clinical time and attention. But as a socialist, Medicare for All means even more. Capitalist society has failed patients like Luis many times over. The creation of the first truly universal social program in the history of the United States is an opportunity to raise awareness that people might simply access the basic resources they deserve and to glimpse just how much the profit motive has made our collective lives worse. In other words, Medicare for All has the potential to change the way that people think about society, what they contribute to it, and what they deserve from it. Luis suffers daily from excruciating mental anguish, but more insidiously, he suffers under the crushing weight of a cruel and exploitative society. For the past 40 years, we've been living under the direction of unregulated capitalism, which has made waking life a living hell for poor and working people. The current struggle for Medicare for All represents the first major structural counteroffensive against the 1%. I am and will be so proud to stand with my patients and coworkers, with my comrades in DSA, and with all of you in this historic fight against the ruling class.